Imagine waking up one day and everything looks like it's covered in a white fog. Faces are blurry, lights have halos, and even reading your phone feels impossible. You clean your glasses again and again, but nothing changes. This is exactly how many elderly people experience a cataract. Let me tell you about a real situation. A 8-year-old grandmother stopped going out for her evening walks. She thought it was just aging. But slowly, she couldn't recognize faces clearly. She started missing steps while walking. And one day, she almost fell in her own house. The problem wasn't weakness. It was cataract. So, what exactly is cataract? Inside our eye, there is a natural lens, clear, like glass. Over time, especially with age or diabetes, this lens becomes cloudy. And when that happens, light cannot pass properly. That's why vision becomes blurred, dull, and sometimes yellowish. Many patients describe it as looking through dirty water or a fogged window. Now here's a common myth. Cataract should mature fully before surgery. That is completely false. Waiting can actually make surgery more difficult and delay recovery. The good news is cataract is completely treatable. Cataract surgery is a simple procedure where the cloudy lens is removed and replaced with a clear artificial lens. The entire procedure usually takes about 10 to 20 minutes. Let's understand briefly how the surgery is done. The doctor makes a very small cut in the eye, uses ultrasound to break the cloudy lens into tiny pieces, removes it, and then inserts a foldable artificial lens. No stitches are needed in most cases. The patient is awake, but the eye is numbed, so there is no pain. Another myth: people believe eye surgery means long hospital stay. Not true. In most cases, cataract surgery is a daycare procedure. The patient goes home the same day after a few hours of observation. Now, let's talk about cost in India, because this is something everyone wants to know. Cataract surgery costs can vary widely from around 10,000 inches, government setups, to 30,000 won, 0 or more, in private hospitals, depending on the type of lens used. Many government schemes and insurance plans also cover cataract surgery, making it affordable or even free in some cases. But surgery is only half the journey. What truly decides success is what you do after surgery, especially in elderly and diabetic patients. I remember another patient, a diabetic uncle who had perfect surgery but ignored his eye drops. Within days, he developed redness and pain. He thought it was normal and delayed visiting the doctor. By the time he came back, infection had already started. This could have been easily prevented. So let's understand the most important thing: eye care after surgery. Eye drops are not optional. They are life-saving for your eye. These include antibiotic and anti-inflammatory drops. Missing them is one of the biggest reasons for complications. And here's another myth. If vision improves, I can stop drops. No. Even if you feel perfectly fine, you must complete the full course. Elderly patients especially need support. Many of them cannot put drops properly due to shaky hands, poor vision in the other eye, or fear. This is where caregivers play a crucial role. Just helping with eye drops on time can prevent major complications. Another important rule: never rub the eye. Even if there is mild irritation, rubbing can damage the healing wound or even displace the lens. Patients often ask, can I cook after cataract surgery? Yes, but with care. Light cooking like boiling or reheating is fine after 2-3 days. But avoid smoke, steam, and heavy work, like lifting vessels or deep frying, for at least 1-2 weeks. And no, you do not need complete bed rest. In fact, early gentle movement is encouraged. You can walk inside the house, watch TV, read, and use your phone in moderation. But avoid bending forward, lifting heavy weights, or straining. Even something as simple as constipation can increase pressure in the eye, so a fiber-rich diet is important. Now let's talk specifically about diabetic patients, because they need extra care. Diabetes slows healing and increases the risk of infection and swelling inside the eye. Blood sugar must be well controlled before and after surgery. Another real example: a diabetic patient had good surgery but poor sugar control. He developed swelling in the retina, and his vision recovery was delayed. This is called diabetic macular edema, and it's more common than people think. So, if you are diabetic, remember this: your eye drops, your sugar control, and your follow-up visits are equally important. Now, another myth. After surgery, I must not move or do anything. Completely wrong. You can do light activities. Just avoid strain. Bathing is allowed, but be careful. No water or soap should enter the eye for about 7–10 days. Head baths should be delayed, as advised by your doctor. Sleeping is important too. Use the protective eye shield at night so you don't accidentally rub your eye while sleeping. Don't sleep on the operated side. Wear sunglasses when you go outside, not just for style but to protect from dust and bright light. Follow-up visits are extremely important. Usually, you will be called the next day, after 1 week, and after 1 month. These visits help detect problems early, even before you notice symptoms. Now, let's talk about danger signs. If there is increasing pain, redness, sudden drop in vision, discharge, or flashes of light, do not wait. Go to the hospital immediately. And please remember this myth: pain is normal after surgery. Mild discomfort is okay, but pain is not normal. Pain means something needs attention. For elderly patients, safety at home is also important. Keep floors dry, ensure good lighting, and assist them while walking to prevent falls. Many injuries after surgery happen not because of the eye, but because of falls. Emotionally, too, elderly patients may feel anxious. Reassurance and calm support from family make a big difference. Now imagine this: the same grandmother who once struggled to see clearly after surgery. She can now recognize faces, watch TV, and walk confidently again. Cataract surgery doesn't just restore vision, it restores independence. And that's the most beautiful part of it. So, if you or your loved ones are delaying cataract surgery out of fear, remember, this cataract doesn't get better on its own. But surgery is safe, effective, and life-changing. Take care of your eyes. Follow the advice properly, and never ignore symptoms. Because vision is not just about seeing, it's about living fully. If this video helped you, share it with someone who needs it, maybe an elderly parent or grandparent. And don't forget to subscribe for more simple and practical health information. Thank you for watching.